welcome to the Australian Centre for Pacific Islands Research. It's our second Pacific seminar today. My name is Bridget Horsey and I'm going to chair the seminar. I am one of the student representatives with the centre along with Danny Medina and Mel Harris. I'm also a nutritionist and a PhD candidate with the University of the Sunshine Coast and of course with the centre. Normally our Pacific seminars are going to be held monthly, but today we are making a very special exception for a bonus seminar, which I think you're all going to enjoy. The topic of today's presentation, I'm sure you can see that on the screen, it's titled Gathering Evidence and Supporting Multi-Stakeholder Engagement on the Roles of Diets and Food Systems in the Prevention of Obesity and Non-Communicable Diseases in Fiji. This presentation will provide an overview of the assessment on the links between food systems, policy and diets in Fiji, conducted by some of our own ACPIR researchers in collaboration with the FAO FIRST Programme, which is a policy assistance facility supporting national food security and nutrition policies in the Pacific. So today we actually have three presenters bringing you this information, and I'm going to introduce them to you now. So firstly, we have Dr. Sarah Burkhart. Sarah, if you don't mind just saying hi really quickly so everyone can see who you are.
Hi everyone, thank you for joining us.
Thanks, Sarah. Sarah is a senior lecturer in nutrition at the University of the Sunshine Coast, and of course she's one of our leaders for the Australian Centre for Pacific Islands Research. And working with Pacific partners, academics and stakeholders, Sarah's work seeks to understand determinants of food security across Pacific Island food systems with a focus on food environments and consumer behaviour and food choices. Sarah's work also focuses on nutrition education and food provision in Pacific Island school settings. We're also joined by Tarli O'Connell. And Tarli, if you can say hi to everyone quickly.
Hi everyone, pleasure to be here. Thank you for joining us.
Thank you, Tarli. Tarli is a public health nutritionist currently working with the centre as well. Tarli specialises in the design, delivery and review of policies that promote healthy food environments and wider food systems for better nutrition. Tarli has held roles with governments and non-government agencies in Australia and the Pacific Island countries. And lastly, but not least, we also are fortunate to have Itziar González presenting today. And Itziar, if you could just say hi to everyone quickly for us.
Hi, everybody. A pleasure to be here. Thank you.
Thank you, Itziar. So Itziar is an agricultural engineer working for FAO as a policy officer with food security, nutrition and sustainable agriculture, working in Vanuatu, Solomon Islands and Fiji. She has previously worked for 20 years implementing and providing technical advice to rural development initiatives in South and Central America and the Caribbean, working for the UN, the Spanish Agency for International Development Cooperation and various other NGOs. Now, before we do get started, I'm aware that we have a variety of people that have connected with us today who aren't already members of the centre, which is great and welcome. But we would like you to, or just encourage you to at some stage throughout the seminar, just briefly introduce yourself in the chat so that we can learn a little bit about you as well. Also, if throughout the presentation you have any questions for our presenters, please put them in the chat and at the end we'll make sure we've got some time there for questions. And finally, make sure that your speakers are muted. If you've got any technical issues, pop them in the chat and Danny and Mel will try to address them. But otherwise, enjoy the seminar. I'm going to hand you over to the ladies now.
Thank you, Bridget, and welcome everyone again joining us today. It's a real pleasure to present this work to you. What we intend to do today is to provide a brief overview of the FAO FIRST Programme. So Itziar is going to do that. I'm then going to talk through a project overview and some of our key findings from the situational analysis that we did. Tarli will then present on the policy landscape activity that took place, and then we'll do a brief summary and have time for questions at the end. So I will pass back to Itziar now to talk a little bit about the FAO FIRST Programme.
Thank you very much, Sarah. I hope you can hear me okay. Well, as Sarah said, I'm going to make a very brief presentation of the program and its connection with the current research, that this is actually what you are coming here to see. So as a very brief introduction, as already Bridget said, FIRST is a policy assistance facility that is implemented in a partnership between FAO, the European Union, and the governments of the countries. In concrete, in the Pacific, we have worked in Fiji, Vanuatu, and the Solomon Islands. And the idea is to address food security and malnutrition issues from a policy perspective. There are a few aspects that we had been promoting from the beginning, including this multi-sectoral approach to food security and nutrition, understanding that we need to incorporate many sectors for addressing the food security and nutrition. We also follow a food system oriented approach from farm to fork, and also try to base the policy making on evidence and promote implementation. We know that the implementation is many times a very weak point in the national policies, because policies are there, but the level of implementation and even the level of knowledge about these policies sometimes very limited. So very quickly, I will try to make the connection of the study with the FIRST program, and these are some of the work lines that we have been following for the past 5 years. One is this generation of evidence to inform policies, and the study has generating evidence, updating some data on food behaviors and diets, but also generating completely new data, for example, about the food environments. I believe it's the first time that we have some information updated and quite comprehensive about the outlets in Fiji. You know that food environments understood as the places where food is available and accessible to people. And we have some information about the outlets in both the main 2 islands in Fiji, about fresh food, and also about the school environments. What is the kind of food that the students are able to find close to the schools in both islands. And we, of course, have generated information about the COVID impacts across the food system. And the idea is, with all this information, we will be maintaining some dialogues with the governments and other partners to try to see how we can inform policies. This is something that we have been doing since the beginning, promoting inclusive policy development. And this year, a golden opportunity arose with this food system summit that the United Nations are holding in September this year. So we are involved with the Ministry of Fiji, and this picture that you see there is a very bad one, but actually I put it there because it's from last week. We are working hard with many ministries, multiple stakeholders, starting this national process of food system dialogues in Fiji, and the study will be providing some briefs for promoting and enhancing the dialogue among them. 2 other lines of work that we are promoting is developing the capacities and facilitating resource allocation. In this sense, an approach that, and this is something that I wanted to highlight from the beginning, how difficult it was to conduct this the research in COVID times with the researchers unable to come to Fiji. So I really appreciate, and we are very grateful for the innovative solutions that they undertook to overcome these issues. No? And part of it is related to the collaborative approach and work with national institutions. From the surveys, they had to train train enumerators for the surveys and count with some local companies to do that. They also, for example, work with the National Food and Nutrition Center in Fiji for updating the food baskets. This is something that they did considering both rural and urban settings, and also Indo-Fijian and Itoke populations. So this is something that that also help to develop the capacities of the national institutions. And definitely something related with capacity was the capacity assessment development tool that Tarli will explain later, trying to assess the effectiveness of the policy, the current policy measures. And the final line of work is this enhancing coordination from a multi-sectoral perspective. I think you will see that the measures that are reflected in the study clearly link to different sectors, and we are trying to identify or to connect these entry points that has been identified to improve the dietary behavior in Fiji through the different elements and in the food systems and with the different stakeholders. So this is something that that the study is also helping us with. That would be my last slide, and over to you, Sarah. Thank you.
Thank you so much, Itziar, for providing us with that background. I'm going to get into talking a little bit about the project, but before I do that, I would just like to acknowledge a wide group of people. Tarli and I, as well as Itziar here, are representing a wider team who undertook this work. So I just wanted to acknowledge all of the input that these people had within the project. As Itziar also mentioned, 2020 was very challenging in terms of the impact of COVID. So we did end up redesigning this project several times. And if we didn't have the assistance of the people that I've listed on this page, this work would not have got done. So we really do acknowledge these people and organisations who have really made this project possible. The project is very, very large, and I'm going to show you a figure to, I guess, put into perspective the scope of the work. And because we are limited with time today, I am going to go through and talk about some of the key findings, but not delve into the methods as much. So if you have got questions on the methods, we're more than happy to answer those. The final report will have the detail on those methods included in it, or you're more than welcome to get in contact with us. The first arm of the project, I guess we could call it, was a situational analysis. And I'm going to talk through these key findings. What we did within this part of the research project was to look at historical perspectives around dietary consumption patterns, as well as aiming to get some more current information on those. We also looked at the food system. So we looked at a COVID-19 impact study, which was obviously in addition to the original work. We looked at several other aspects, including developing a Fiji healthy food basket, looking at food price monitoring data. We looked at local food environments and school food environments. We did some GIS mapping of the fresh food system. And we also did some interviews with the people we collected data from on dietary intake to understand consumer purchasing behaviours. We also had an online survey that we used as well. And you can see with some of those data sets, we have got quite a substantial amount of data, which again, I just want to reinforce, we're going to go through some of the key findings today, but don't have the time to add all of those, but they will be available in the report. The next part of the project that Tarli will talk about is the policy landscape. So this part of the project ran alongside our situational analysis and focused on a desk review of policy documentation. And that included all sectors that had potential to influence the food system and diets in Fiji. Tarli will talk through the questionnaire and capacity and assessment tool that she developed, as well as the findings from interviews which she undertook. So these two parts of the project have then informed our next steps, which Itziar mentioned was around policy dialogue, and particularly around how this information can help promote or facilitate discussion around the action tracks within the UN Food Systems Summit that is planned for Fiji later in the year. I'm going to run through some of our key findings for you. You will notice up in the top slide, I have put a small screenshot of that figure, and I'm hoping that that's because when we do move through quite a few different findings, you can still see where they fit within the context of the project. So one of the first activities that was undertaken within the project was to look back at the literature, looking at dietary patterns in Fiji. We found that there was not a lot of literature, but what we did find was quite inconsistent in terms of the methods that have been used and the population groups that have been studied. So that does make it quite difficult to make any comparisons across those changes. But what we did find that while we couldn't delve into those and do really good comparisons between different data sets, that there has been a shift from traditional food consumption patterns to diets which are more heavily reliant on imported and increasingly processed foods. And this is being seen in both rural and urban populations. We did note too that over the past 2 decades, the Fiji population has in general, in line with that, increased their consumption of animal protein, both in fresh and canned forms, as well as other foods, but decreased their consumption of those local fruits and vegetables. And this has resulted in lower overall dietary diversity. And I think it's interesting to note that looking at this data, dietary diversity appears to be the most common form of looking at dietary patterns at the moment. But a great challenge within that as well is that that is not always done in a consistent manner. So it has been quite difficult to look at those pieces of literature. In order to try and get some more current information on dietary intake was quite challenging during COVID. So we did again revert back to using a dietary diversity assessment method. Within this, we had enumerators going out to 5 different locations in Fiji, which were chosen based on a variation between rural and urban settings. So we had 467 people agree to participate in an interview. We got dietary intake data from 369 of those because we found that some people mentioned that the day before was not typical of usual consumption. Because we were interested in looking at some of the differences between rural and urban and individual and household consumption, we actually used a dietary diversity method where we asked people if they were responsible for the procurement and preparation of food for a household in the previous 24 hours or not. And if they were, we asked them the dietary diversity survey in relation to their household, which is the HDDS that you can see there. If they told us that they weren't responsible for procuring or preparing food for anyone else, we use the individual dietary diversity score. So you can see that those are quite low and they are in line with the other data that has been presented for Fiji recently. Quite interestingly, we had just almost a third of the participants who were talking about their individual consumption and food procurement in the previous day, reporting that they consumed food from out of the home. This figure here also shows you some detail around the consumption of food groups and the proportion of people within the individual and the household groups. And you can see that there are some quite clear differences between some of those foods in terms of who is actually consuming those, as well as some of the foods that we saw reported more frequently compared to those of less frequently. We asked the same population about their habits or their patterns of growing and purchasing their own food as well. And this was quite interesting because when we asked them about their particular community or their neighbourhood, there was quite a positive response in terms of being easy to buy or purchase fresh fruits and the vegetables in their community, that this was of high quality, that there's a good selection of this, and that they're sold at a reasonable price as well. When we did ask who was growing some of their own food. We had 82% of those participants report growing some of their own food for consumption, with the 5 most frequently reported foods listed there. So cassava, eggplant, ballet, beans, and taro. When we looked at mapping, so this included over 1,100 commercial outlets. So you can see on the slide there the list of the different types of outlets that were included. This group of data is based on looking at those, mapping where they are in Kobo Toolbox, and then identifying if they're selling particular foods. So when we looked at those commercial outlets, 70% sold fresh vegetables, around half of them were selling fresh fruit, similar numbers for root crops, and then you can see slightly less for dairy products and also seafood and fish. Within this mapping exercise as well, the team also looked at where these outlets were distributed in order to give us an indication of access to these particular food groups. So the ones that you can see here on the 2 main islands of Fiji, this represents shops and supermarkets which are selling fresh fruits and vegetables at the time of data collection. So you can see that they do tend to follow the main areas around the coast, but you can see that there are those clusters around the more urban areas as well. Another part of our data collection to look at the food environment was to look at school food environments as well. So we looked at 88 schools, and these were all schools which are currently included in the World Health Organization's Health Promoting Schools program. And this represents 43% of those, this data collection. We did several activities within the school setting where we had enumerators go to the school and ask whether they could undertake interviews with a school stakeholder, as well as mapping the local environment around schools. So what we found is almost all of those schools reported use of a food or nutrition policy to support healthy food choice. 47 of those schools had a kitchen, but only 32 of them were currently being used to prepare food for their students. Meals were provided at 39 schools, with the most common meal being lunch. Of those 88 schools, 71 of them reported having a garden. And when we asked subsequent questions, we found that 58 of those 71 reported using their garden for food production. So over half reported the produce was consumed by students, and the garden is being used for curriculum activities as well. We also looked at mapping the school food environment. So on the side of the screen here, you can see 2 small pictures. So this indicates what we did. We gave the enumerators a 400-metre radius around the chosen schools, and we asked them to walk in that radius, selecting all of the outlets that were selling food, to record what they were and whether they were selling from a predefined list of foods. What we found with this was that there were quite a lot of outlets within these 400-metre radiuses, with obviously more in urban locations than rural locations. Just to highlight a couple of these, we found that 80% of those outlets within those 400-metre radiuses around schools were selling sugar-sweetened beverages. And also a high proportion of them were selling lollies, candies, confectionery, and those other foods that we would be typically recommending less consumption of. In addition to the school food environments, we also mapped local food environments. So where possible, we matched these local environments with the locations where we surveyed people about their dietary diversity and their food purchasing behaviours. When we looked at this, we had 284 food outlets across both main islands of Fiji, and you can see the distribution of those there on the side. So this was a 500-metre radius from the centre of that community or the centre of that location. So again, there was a really high prevalence of availability of sugar-sweetened beverages in those locations. Also quite high prevalence of water, prepackaged juice, and fried foods. Less prevalence with some of the other food groups. And of course, with these, we also know that people are reporting their own production of some of these too, which would explain why we are seeing slightly less numbers in terms of things like fruits and vegetables. But I think particularly concerning when we think about some of these foods, which there is high availability. When we looked at these aspects of availability too, we actually developed some heat maps to show just what that availability looked like. So we have separated them here into food groups based on the Pacific Islands guidelines to a healthy lifestyle food groups. I'm just going to show you 2 examples just to show you what that difference is. So this is the mapping from Suva. So within Suva, we had 2 locations that were chosen. And you can see here, this is the availability of energy foods. So those starchy type items. The numbers in the small circles are the numbers of outlets that actually had these foods available for sale. And you can see as the colour gets more towards red, that indicates a higher availability. So that's our energy foods. This here is our bodybuilding food. So you can see that there is more availability of these items than of the energy foods. And then if we look at what we have considered discretionary foods, there's even more availability of those. So that's reflected in not just the colour there that you can see with the heat mapping, but the number of outlets as well. So 65 and 18 just within the main part of Suva, and 26 up in Nasenu. To show you another example from Lautoka, so slightly more rural, we did find similar results in this, and that there was some availability of energy foods, a little more of bodybuilding foods, but much higher of these discretionary foods as well. The data that we collected around affordability of a healthy diet was based on the development of a new healthy food basket for Fiji. So as Itziar mentioned, we developed a basket that was based on culturally appropriate food, but also reflected the nutritional requirements of the reference families, which is a little bit different to some of the other baskets which are traditionally used, where it's not based on meeting those nutritional requirements. So you can see in this table the different food baskets that we had, as well as the total possible food items that were in each of these baskets. We used the same locations where we did the mapping to get this data, but what you'll notice is that when we look at the total food item availability, it is quite low. So it was impossible to get every single item that was in each of those food baskets, which I think in a way is a result in itself, in that the availability is not there, even though we took into account what are typical foods in the development of those baskets. When we look at it at a food group perspective, not surprising based on the mapping, it was much easier to find foods within the oils and fats, eggs, dairy, sweets, grains and cereals food groups, with less availability of other foods. And this figure here, I think quite nicely shows you some of the differences between price of these products as well. So you can see urban pricing there is reflected in the blue and rural in the orange. So what this shows you at first glance is that there's actually no availability of some of these products in rural locations. But there is a price difference between them where you can get both, or in both locations. The COVID impact study as well, again, it was a new addition to the work. We looked at farmers, market vendors and consumers, and they all indicated that as a result of COVID-19, they had reduced their consumption of fruits and vegetables. You can see there that what they have replaced, that reduction in fruits and vegetables does vary a little bit depending on the group that you look at. But we did find that almost 19% of Fijian women reported decreasing their consumption of fruits and vegetables compared to 12% of men. So that does need a little bit more analysis and looking into. We did also find too that farmers reported that there were some issues in sourcing seed and planting materials, with the farmers on Viti Levu more likely to report an impact on their production. And that vendors also noticed challenges in sourcing products. And while they were seeing lower levels of consumers, consumers were also purchasing less than they had previously. Within the online study that we did as well, we asked participants to tell us a little bit about changes in their diet as a result of COVID-19. And I've just put one of these figures up because we have them for all of the different food groups. You can see it's quite interesting here. We've got people who are saying they eat or drink more of a particular food, they eat less of it or drink less of it, or they have about the same amount. So this is quite interesting in that people are saying, well, 48% of people are saying that they eat or drink more, or eat in this case, fresh vegetables. So again, we need a little bit more information on why that might be the case, but we do hypothesize that that might be going back to people with home gardening and taking up home gardening if they weren't already doing that. We did as well, not intentionally, but through part of the process of the project, find quite a lot of responses to different parts of the data sets that were linked to COVID. So I have just put some of the quotes up here from the participants who did dietary diversity and when they made reference to COVID. So you can see that there are different ways that they are seeing COVID as impacting what they consume and what they're doing in their day-to-day lives that might then reflect on food security and nutrition. We also found quotes, which I haven't put up here, from school stakeholders who mentioned that some schools saw benefits to COVID and that they focused more on school gardening and that they, I guess, were returning back to more traditional practices. But we also had other schools saying that it made school lunches unhealthier because parents were relying on more processed food that might be cheaper to put into lunch, or that they weren't able to continue with planned activities because of the impact of COVID. So with that, I have run really quickly through some of those key findings just in the interest of time. And as I mentioned, we're more than happy to expand on those and answer questions and share methods and so on. But I'm going to pass to Tarli to talk through the policy landscape as well, which, as I mentioned earlier, ran alongside the situational analysis and is a really important part of the project. So I'll pass to you now, Tarli.
Thank you, Sarah. I'm now going to share with you some findings from the policy landscape part of the research. As Itziar acknowledged earlier, the findings of this work will feed into the upcoming Fiji National Food System Summit Dialogue. So I will also, as I go, make some connections to the Summit Dialogue action tracks for those this may interest. As Sarah touched on, this work aimed to provide a detailed understanding of the wide-ranging multi-sectoral policy landscape in Fiji and how this influences the food system and diets. It involved three components. The first, an analysis of the policy context. The second, an analysis of policy measures. And the third, an analysis of capacity for policy effectiveness. So starting with the policy context, here we specifically aim to understand what are the key guiding documents that define the strategic and policy priorities in Fiji and thereby inform policies that influence the food system and diets. We examined international guiding documents, whole of government guiding documents and sector-specific guiding documents such as ministry strategic development plans. In the time I have today, I'll provide a very brief overview of the guiding documents found to influence policies relating to the food system and diets in Fiji. The final report, however, provides more information about these documents and further analysis of how they may influence Fiji's food system. So starting with international documents, the Fijian government has made strong commitments internationally to ensuring healthy diets for all Fijians through their endorsement of the following global and regional frameworks: the NCD Global Monitoring Framework, the Pacific NCD Roadmap, the Rome Declaration on Nutrition, and the Sustainable Development Goals. The planned UN Food Systems Summit member state dialogues, while announced following the completion of this work and therefore not acknowledged in the final report, is certainly another example of Fiji's international commitment to a healthy food system and diets. Domestically, Fiji's whole of government strategic documents also demonstrate the government's commitment to healthy diets. This is a valuable enabler of policy action in this area. More specifically, the 20-year National Development Plan, or NDP, lists food and nutrition security as a key focus area. This is to be primarily achieved through increasing local food production, noting there are no indicators in the plan relating to foods consumed. The 5-year development plan, which guides delivery of the NDP, also includes food and nutrition security as a key sector of focus. It identifies there is a need for multi-sectoral action and lists the development of a national food and nutrition security policy as a key deliverable. The 5-year plan does include targets not only to increase local food production, but positively for the consumption of healthy foods. The 20-year and 5-year plans also contain targets for cross-cutting areas that contribute to healthy food systems and diets, such as improving maternal and child health, though other targets, particularly around economic growth, have potential to both help and hinder this. A wide range of sector-specific guiding documents were also identified that have the potential to influence policies which shape Fiji's food system and diets. Most of these documents are listed here, though some others were identified that are in development or pending revision, all of which are detailed in the final report. Again, while the report provides more details as to how each document could be influencing policies and shaping the food system and diets, there are some overall observations I will share. The first is, of course, the large number of sectors that influence the food system and diets in Fiji and the value in multi-sectoral action. This is planned for by the National Food and Nutrition Security Policy, though this has long been pending approval. Along these same lines, there is also a need to find balance between sector priorities when preparing policies given their various influences on the food system and diets. For example, finding balance between economic development, natural resource management, climate adaptation, gender equality, and nutrition, to name a few. This is a challenge not unique to Fiji, and I know a familiar challenge for many that I interviewed. Thirdly, potentially of relevance for the Summit Dialogues Action Track 3, the agriculture sector, encompassing crops, livestock, fisheries, and aquaculture, may benefit from a sector-wide strategy that facilitates integrated farming systems and more diverse and sustainable local agricultural production. And lastly, of relevance for Action Track 2, while there are clear commitments amongst sector-specific guiding documents to food production and food security in terms of amount of food available, there is opportunity for clearer commitments relating to food consumption. These are some, but far from all, of the observations and potential entry points for future work we identified. The second part of the policy landscape analysis examined the wide range of policy measures and related initiatives in Fiji that influence the food system and diets. It examined not only policy measures in place, but also policy measures that are planned or in development and any gaps in policy measures or opportunities. We made a large effort to examine policy measures influencing all or each function of the food system. For example, not concentrating only on food production or only on the food environment, but all functions, and these are listed here on the left. From food production to post-harvest handling and processing, food trade and marketing, and consumer demand, as well as cross-cutting elements such as gender equality. In the final report, policy measures examined are then grouped further into subcategories under these functions, and these subcategories are presented here on the right. For example, under food production, we looked at policy measures that influence the nutritional diversity of agricultural production, the sustainable intensification of agricultural production, biodiversity and biofortification, urban and peri-urban agriculture, and technical support for agricultural production. As you move down the list, you can see other areas examined, such as post-harvest handling and transport, food labelling, nutrition education, and land tenure, for example. In the time I have today, I won't be able to share with you all of the findings, though I would love to, but instead will provide you with a brief summary of findings for two of these subcategories: biodiversity and biofortification, which comes under food production, and domestic markets for agricultural production, which comes under food trade and marketing. This will give you an insight into the type of further information that is available in the final report. In this part of the report, we identified policy measures and policy opportunities relating to biodiversity and to biofortification. Biodiversity plays an important role in ensuring the sustainability of the food system and that people eat a diverse diet and receive a wide range of nutrients. It is of relevance for action track 1, 2, 3, and 5. Biofortification, for those that may not be aware, involves developing new crop varieties with the aim of enhancing their nutritional value and is a useful tool in combating micronutrient deficiencies. It is of relevance for action track 1 and 5. Key findings included: Fiji has a national biodiversity strategy and action plan in place, recently launched by the Department of Environment. It contains quite a comprehensive set of actions and targets under the goal to conserve and sustainably use Fiji's biodiversity and to maintain the ecological systems that support it. Positively, the plan acknowledges the role of biosecurity in providing food security and includes actions to promote sustainable agricultural production, forestry, fishery, fishing practices, and natural resource management to, quote, secure food provision in changing local climatic conditions. The plan lays out an implementation mechanism overseen by the National Environment Council. Secondly, the Ministry of Agriculture is undertaking research to strengthen and revitalise traditional food crops. Their costed operational plan has a target for 12 Indigenous crops to be available for distribution to farmers this financial year. Such a measure can assist Fiji to protect biodiversity amidst their efforts to scale up and intensify agricultural production. Third, the Ministry of Agriculture and the Pacific community have invested in the research, development and release of seeds and tissue culture materials to produce climate resilient staple crops and, through the Seeds for Life project, are establishing a system to produce quality vegetable seeds suitable to the Fijian climate and soils that previously relied on importation. These two initiatives support food security and nutrition in Fiji by ensuring the availability of planting materials to produce fruits and vegetables in a crisis. While planting materials include nutrient-rich varieties, these initiatives have not specifically endeavoured to improve the nutrient content of planting materials and foods. Among a list of planned research and development programs in the Ministry of Agriculture's SDP, there are none that involve biofortification, and no biofortification activities were identified across agencies interviewed. To improve the nutritional value of foods produced and available in Fiji, there may be opportunities to integrate biofortification measures into research and development activities currently focused on climate resilience and yield. While these are the key policy measures identified relating to biodiversity and biofortification in Fiji, there are some additional references in the final report to policies influencing biodiversity under other subcategories, particularly sustainable intensification of agricultural production. Moving on, under this area, policy measures and policy opportunities were identified relating to domestic markets in Fiji for agricultural production. This is of relevance to action tracks 1, 2, 3, and 5. Key findings include the Ministry of Commerce, Trade, Tourism and Transport is committed to improving market access for locally produced foods in domestic as well as regional and international markets. The Ministry has established an agriculture subcommittee per the Fiji Trade Policy Framework to enhance market linkages for agricultural products in Fiji's domestic and international export markets. Given the economic value of export markets, there is an important balance to be found to ensure the domestic availability of diverse and nutrient-rich local foods. Measures to establish domestic market linkages for agricultural products have previously concentrated on the tourism sector, given its large market share and high imports bill, though due to COVID-19 are no longer prioritised. A principal policy measure to create market linkages for agricultural products in Fiji is the formation of the Agricultural Marketing Authority, established under the Ministry of Agriculture by the Agricultural Marketing Authority Act. The AMA purchased a large amount of fresh, nutrient-rich produce from small-scale farmers to supply local markets across Fiji and provide farmers with a contract enabling them to access credit and financial services. Markets for Change is a women's economic empowerment initiative implemented by UN Women in 13 out of 15 municipal markets in Fiji. The program involves making physical infrastructure improvements to municipal market structures, a review of municipal council market bylaws, and extensive training and capacity development of market vendors. And lastly, a target within the Ministry of Commerce, Trade, Tourism and Transport strategic plan is to provide infrastructure to establish standardised roadside market stalls outside of urban areas. Originally proposed to create economic opportunities and improve the safety of informal roadside market activities, the initiative was prioritised by COVID-19 as travel restrictions limited access to municipal markets. The initiative can improve access to healthy, nutrient-rich foods in participating villages and can create shorter supply chains, potentially reducing food loss. To expand and sustain the initiative, in July 2020, the Ministry launched a public-private partnership program whereby partners are provided with a panel on market stalls for advertising. There are some opportunities across these initiatives for nutrition to be further considered. Some examples are for a health or nutrition representative on the Agriculture Subcommittee, the inclusion of standards relating to nutrition in the market bylaw review, such as how cooked food is prepared, and restricting the advertising of unhealthy foods on standardised market stalls as part of the public-private partnership program. Again, while these are key measures identified relating to domestic markets for agricultural production in Fiji, there are some additional references in the report to policies influencing markets under other subcategories. The third and final part of the policy landscape analysis examined the capacity, assets and needs that affect policy processes in Fiji at the enabling environment, organisational and individual levels. The findings are presented in the report under the key elements of the policy process, including policy development and review, policy implementation and policy monitoring and enforcement. The findings in this section are relevant to all action tracks. Given time, here I will briefly mention a few of the findings under each element, though further information is available in the final report. Policy development and review. The process of policy development in Fiji is enabled by the government having clearly defined long-term strategic priorities per the NDP, as well as sector-specific plans. The policy development process is further enabled by the government's drive for quality and improvement and innovation, which encourages bold policy thinking. There are, however, some opportunities for more meaningful consultation and contextualisation to ensure policies progress successfully through approvals and can be feasibly implemented. Policy implementation. When it comes to implementing policies and related programs, implementation teams face challenges due to tight budgets and with competing priorities. There is opportunity for the implementation experience to be factored in further in the policy development process to strengthen delivery. Policy implementation in Fiji is also difficult given its geography and environmental challenges, such as natural disasters, which can cause considerable delays to the reach and delivery of policies and initiatives. Government departments are mindful of these challenges, however, and are taking some steps to address them, such as engaging the private sector to assist delivery. And policy monitoring and enforcement. Compliance with policies such as the National Food Safety Regulations is largely done reactively as a way to manage resource limitations. Gaps in Fiji's testing and analysis capabilities do cause challenges for both those monitoring policy compliance and for businesses seeking to ensure their own compliance. Positively, there has been a large investment in strengthening the Ministry of Agriculture's monitoring and evaluation capabilities, and this has the potential to inform effective policy review and development. I'll now pass back to Sarah, but would again like to thank all of those who participated in the interviews and supported this work.
Thank you very much, Tarli. I'm conscious that we are getting very close to the end of our hour, so a very brief summary for you before we hopefully have a few minutes left for questions. Is that what we have shown you here today, like I mentioned, is very much a snapshot of the project. What was evident from both of those aspects of work, though, is that there have been changes in diets in Fiji in both rural and urban populations. When looking at food environments, we found that these have the potential to support healthy but also unhealthy food choice, and that warrants more work. We found when looking at some vulnerable groups, for example, children, if we're looking at the areas and the spaces where they spend their time, like schools, this needs attention. And there is obviously need for multi-sector engagement and collaboration within this, as Tarli's mentioned, throughout the policy landscape. In terms of moving forward, we have a final report that is currently being published by FAO that will provide far more detail than we've been able to give you today, and that will be available at some point. We are developing some policy briefs based on the action tracks for the UN Food Systems Summit. We also are looking at how that can be used for policy dialogue as well. And my last little point there, I can't see, is linking that back to the UN Food Systems Summit as well, and supporting where we can to do that. So with that, I would like to thank you for your attention. I know we have moved very quickly through lots of aspects of the project, but as I mentioned, we're very happy to answer any questions. If you'd like further information, please feel free to get in touch as well. But thank you.
Well, thank you, Sarah, Tarli and Itziar. I can imagine it was quite difficult to summarise so much work into one short presentation, but I think you did really well. We do have some time for questions, so I'm going to hand you over to Danny in a minute. But before I do, I think on behalf of everyone, I'd like to say thank you so much for presenting today. That was very interesting and informative, and I think it's clear that all three of these ladies are doing some incredible work that is very important towards improving the health outcomes for our neighbours in Fiji. So thank you, ladies. Now I'll hand you over to Danny, who is going to read out some of those questions from the chat.
Thank you, Bridget. So yeah, we've been having a few questions popping up in the chat. So the first one is from Colin Bell, and he's interested in why fresh fish availability was low. And he wonders if households are catching their own fish or perhaps bartering.
That is a great question. Thank you, Colin. And I think just based on where we were able to get those data sets might be reflecting why that is quite low. We haven't popped it in this presentation, but we did have quite a number of people report that they do source their own fresh fish. So I think that is a combination of people having access to that, just like fruits and vegetables as well, that we probably need to delve into a little bit more and look at those purchasing behaviours.
Great. So we have another question from Cisse Molimau, and she says, great presentation, and I'm curious how the cost of meat alternatives compared to the cost of fresh fruit and vegetables, and how that impacted purchasing behavior and volume in the diet of consumers.
That's a great question. Thank you, CA. We looked at food purchasing behaviours, which we haven't presented all of that today, and there were obvious differences between those different items. And if you like, I can send you probably a little bit more in-depth findings on that, or share some of those, because we did find some differences between them, particularly looking at rural and urban populations. So again, I think when we looked at food choice, which we didn't present on today as well, we found that cost was one of the most significant impacts on food choice decisions in both the rural and urban populations too. So we'd be happy to share more of that. I'm probably just making it very simplistic in that response back.
That'll be great, thank you.
Thanks. And so maybe just a couple more final questions. One's from Salot Nasalo, one of our ACPIR students, and it says, I have a question in regards to how the COVID-19 impacts in the case study areas in Fiji. Were there any advantages COVID-19 impacts in these study areas? If yes, what are they? And what are some recommendations in research for future researchers that remain? Where upcoming researchers can take up from interest students and assist in Fiji and the Pacific region, Vinaka.
That's a wonderful question. And Itziar and Tarli, please jump in if you want to add anything to these. We do have quite a lot more detail on the COVID-19 impact studies. So we can share that final report as well, because that is available at the moment. And there were some quite interesting findings in that. And I think there are several avenues for moving that type of research forward, particularly looking at the gender aspect, but also more so looking from a nutrition perspective, and I'm probably showing my bias a little bit there. But we did notice that there were quite interesting differences between different groups within the population. So I think expanding on some of those would be a nice step forward.
Excellent. And perhaps the last question, this is again from Cise, and she is asking directly to Tarli. She says that she's curious if your analysis identified ways in how the Pacific could better implement policies. We're very good in developing policy, but usually struggle to implement or enforce these policies.
Mm-hmm. Thank you for that great question. It was certainly something that we examined in detail, is the capacity for policy implementation. And the final report does provide a lot of insights into what's working well in policy implementation and what some of the challenges are. I think very briefly, one of the main observations is that implementation is perhaps not adequately considered in the policy design phase, and there were various reasons for that. So it might be that sort of more work needs to be done when policies are in development, really making sure that they're feasible and able to be implemented and adequately resourced. Implementation teams were certainly very stretched and had difficulties in delivering all of the things that they were being required to. So agree, it's a very important part of the work. Thank you for the question.
Thanks for all those great questions, everyone. I think we're going to have to wrap up the seminar now, unfortunately. I'm sure we could keep talking and asking more questions. Finally, again, thank you to our fabulous presenters today, and thank you to everyone who has connected as well. For those of you who would like to receive any updates on any of our upcoming seminars, please do get in touch. Thank you, and have a good rest of your day, everyone.